So this particular study came on the heels of another study for transcatheter pulmonary valve that was used in congenital heart disease. The first product was actually the first transcatheter heart valve that was ever implanted. It was called the Melody valve, also manufactured by Medtronic. And the patient population for that particular valve are patients that have what we call a right ventricular to pulmonary artery conduit surgically placed. So that product was for conduits. That's only about 22–23% of the population. The big population don't have that surgery. They have what's called a transannular patch at the time. They don't have a conduit. So this study was designed to try to treat those patients with the first such valve that could be fit into the what we call native outflow tract where there's no conduit. So the design and everything was completely different. The patients, by and large, has had they were tetralogy of Fallot. They had surgical correction. 95% of them had previous pulmonary stenosis. And through the correction, the surgeon can put a patch across where the valve and the narrowing is, so they're left with severe pulmonary regurgitation or leakiness because there's no valve function. So this particular patient population are really left with severe pulmonary regurgitation, which they do very well initially as little babies and kids. But over a period of time, the severe pulmonary regurgitation puts an undue stress on the right pumping chamber, and they ultimately get abnormalities and they get symptoms later in life. So this is to restore pulmonary valve function in those patients. Yeah, so the design of this particular device, it's a porcine pericardial valve or pig valve. Another product that Medtronic makes it has this very same valve for older adult patients with transcatheter aortic valve called the core valve. It's the same valve, but it's put into a entirely different frame. And so the frame is a cloth frame that's self-expandable. The valve's inside. And so when you implant this, it really fills the space of this large outflow tract and the valve starts to function. It was designed to treat anybody that has severe pulmonary regurgitation after surgical repair of tetralogy. And in this particular study, half the patients, a little over half the patients, were teenagers and young adults. And the other half the patients were older patients all the way up to 57 years of age. This was the first ever FDA Early Feasibility Study, EFS. The FDA created a pathway a few years ago, for companies to test a new product that was not finalized yet. And so, as we say, it's called an early feasibility. So this was the first one that was approved. And so it's a time to test the theories of how the valve's going to work and how is it going to perform. And so it's really, because it hasn't been performed in humans. So the study, we had 20 patients that could be enrolled in 3 centers. They're followed very closely. The results we were very happy with. There were 2 patients in which we ended up surgically removing the device for specific reasons, and they had the standard surgical repair, and they did well. The other 18 patients, we presented today the 6-month follow-up, and the valve is working perfectly. There's very little, if any, leakiness of the valve. There's no leakiness around the valve. There's been really no major problems with our 18 patients we followed. In our own center, since we performed the procedure first, and that was in May of 2013. So we have 5 patients that have 2-year follow-up, and we have patients coming for their 3-year follow-up. But today we presented the 6-month data from all 3 sites, and the results were quite excellent. So the take-home message is the way that this was designed, the way the study was carried out, carefully engineered, an engineering study, it works. So now the goal is to expand the number of the valves and the frames that are available, modify some of the delivery system so that more patients will be able to be served by this particular product. We're planning, Medtronic has been in contact with the FDA, so we're starting a larger pivotal IDE trial this year. Hopefully we're starting this year, and then we'll continue to expand that. So patients that really had no non-surgical option are going to have a catheter-based option in the future.